Morning students, I am Ms. Republica Borgohain, Assistant Professor, Assam Downtown University, Department of Pharmaceutical Science. So today I will be discussing about the topic related to herbal drug technology. So the topic is Indian System of Medicine. So here it begins. So we know that traditional system of medicine, it plays a very important role in primary health care. So the system of medicines which is of Indian origin and which has come to India from outside and has got incorporated into Indian culture, it is known as Indian system of medicine. So Indian traditional medicine is based on three different types of medicines, which include Ayurveda, Siddha, Unani, Yoga, Naturopathy and Homeopathy. Now the majority of Indian traditional medicine is based on three different systems, that is Ayurveda, Siddha, Unani and Homeopathy. So now I will be discussing about Ayurveda. So Ayurvedic system of medicine, it is the oldest medical system. The word itself means the science of life. The concept of Ayurveda was developed between 2500 and 500 BC in India. The word Ayurveda, it consists of two Greek words, that is Ayur and Veda, where Ayur means life and Veda means science. According to Hindu mythology, it states that there are 4 Vedas which has been written by the Aryans and it forms the backbone of the Indian civilization. The 4 Vedas are Rig Veda, Samaveda, Yajur Veda and Atharva Veda. And Ayurveda, it is the part of Atharva Veda. So there was a first book which includes the concept of the practice of Ayurveda. So that first book was none other than Charaka Samhita. So Charaka Samhita was the first book. It consists of the concept of practice of Ayurveda. We can also say it is a school of medicine. And it describes about 600 plants and their products which is used in medicine. It was recorded in 1900 BC. Now comes the Sushruta Samhita. It was the next Ayurvedic literature which aimed on surgery, and we can also say it as school of surgery. It deals with different theories and fundamental principles of surgery. It describes about 650 drugs, different surgery related topics like anatomy, toxicology, embryology, etc. It also describes the use of various surgical instruments like scissors, forceps, scalpels, etc. So that was the slight introduction regarding the Ayurveda. Now we are going to discuss about the basic principles of Ayurveda. The basic principles of Ayurveda, it consists of, first of all, Panchamahabhutas. According to Ayurveda, the universe is made up of 5 basic elements, which is also known as Panchamahabhutas. So they are Akasha, that is space, Vayu, air, Teja or Agni, that is fire, Jala, that is water, and Prithvi, that is earth. All these are mixed in an infinite variety and they are distinctly unique to each other. If there are any constant change or interaction occurs between these 5 basic elements, then it creates a situation which keeps the world moving. So there is a special interaction between the Akasha, Vayu, Teja or Agni, Jala and Prithvi, which keeps the earth moving. So now Akasha means it corresponds to space within the body, that is mouth, nostrils, abdomen, etc. Vayu, it denotes the movement, muscular, also nervous system. Agni, it regulates the functioning of enzymes, that is intelligence, digestive system and metabolism. Jala, it denotes all body fluids, that is plasma, saliva, digestive juices. Prithvi means the solid structure of the body, that is which includes the bones, teeth, flesh and hair. So overall we can say that Panchamahabhutas, they serve as the basis of all diagnosis and treatment related to Ayurveda, and it is the most valuable theory for physicians to detect and treat illness of the body and mind. So now comes the 3 gunas. The 3 gunas, that is Sattva, Rajas and Tamas, these are the 3 essential components of the mind. Now the Ayurveda, it describes people on the basis of their manasa, that is psychological state, and prakriti, that is constitution. So this psychological characteristics depend on the amount of three gunas. That means the proportion of the amount of three gunas, if it is in the equilibrium state, that means in equal proportion, then it maintains the healthy state of mind. If any disturbances occurs in this equilibrium, then it results to mental disorders. So now sattva means lightness, consciousness, pleasure and clarity, free from disease and cannot be disturbed in any way. It activates the senses and produces the perception of knowledge. Now rajas, it has motion and stimulation. So we feel like desirable or some wishes, ambitions, which we have some desires, wishes, ambitions, and sometimes fickle-mindedness also occurs, and this occurs due to this guna, that is rajas. So now comes the tamas. It is characterized by heaviness and resistance. It causes disturbances in the perception and activities of the mind like delusion, laziness, sleep, and drowsiness. So tamas, it causes disturbances in the perception of the knowledge and in the activities of the mind like laziness, sleep, and sometimes drowsiness also occurs. Now discussing about the three dosas. Three dosas means the three dosas that are vata, pitta, and kapha. So here vata means air, pitta means bile, and kapha means phlegm. The three dosas, that is tri meaning three, and dosas means the basic physical energies. So these are the primary and essential factors of the human body that control our entire physical structure and function. So these three doshas, these are the primary essential factors of the human body, and this controls the entire physical structure of the body. So now discussing about the health effects of dosas. So if these three dosas, they are in the balanced state and imbalanced state, what occurs? So the first three dosha, that is vata, that means air, if it is in the balanced state, then the emotional balance, it gives a clear mind, good complexion, good digestion, and fertility. If it is in the imbalanced state, then the disorders like insomnia, cough, fatigue, cancer, diarrhea, gas, constipation, back pain, and all this occurs. Then in pitta, that is, if it is in the balanced state, then it gives good digestion, motivation, sweating, strong heart, good eyesight. If it is in the imbalanced state, indigestion occurs, heart attack, acne, rashes, liver problem, anger, anemia, this disorders it occurs. Kapha, that means phlegm. If it is in the balanced state, then strength, immune response, and the lymphatic movements, this remains in the proper state. And when it is in the imbalanced state, then obesity, asthma, lethargy, swelling, irritability, headache, slow digestion, these things may occur. Now comes the saptadhatus. So saptadhatus includes the nourishment of the 7 body tissues that takes place in sequential manner. And these saptadhatus, they are originated from the digestive food material. So the saptadhatus, they form the pillars of the body. So these are means of nourishment and growth, and also provide support to the body as well as the mind. So there are 7 dhatus that are rasa, rakta, mamsa, meda, asthi, majja, and sukra. So rasa means fluid. It is derived from the digestive food. It nourishes each and every tissue and cell of the body and is similar to plasma. So rakta means blood. It is similar to the circulating blood cells. It nourishes the body tissues, provides physical strength and color to the body. Then comes the mamsa dhatu. It means muscle tissue. It provides physical strength and support for the meda dhatu. Now, what means meda dhatu? Meda means fat. So, it consists of adipose tissue. It provides support to Asti Dhatu and lubricates the body. So now Asti Dhatu means it consists of bone tissues. It includes cartilages and its main function is to give nourishment to the Majja Dhatu and provide support to the Mamsa Dhatu. That Asti Dhatu means, Asti means bone and it includes cartilages and their main function is to give nourishment to the Majja Dhatu, that is the bone marrow. Majja means bone marrow and Mamsa Dhatu means the muscle tissue. So now comes the Majja Dhatu. It denotes the yellow and red bone marrow tissue and its main function is to fill up the Asti Dhatu. And lastly, it is the Sukra Dhatu. It helps in reproduction and strengthens the body. So now the 7 dhatus, they derive energy from each other. If one of them gets affected, then others also can get affect and there may be disbalances in the functions of the body. So now comes the 3 malas. So malas are the various waste products of food and the dhatus produces during the normal digestive and metabolic processes. The 3 malas are Purisha, Mutra and Sweda. Purisha means feces, Mutra means urine, Sweda means sweat. So malas are the waste products of the food. So a balanced condition of dhatus, dosas and malas means arogya. That means disease-free condition. We can say if we are free from, if there is a balanced condition among the dosas, dhatus and malas, then we can say that we are arogya, that is free from disease state. And their imbalance can cause illness. So discussing about Purisha, it is the waste left back after nutrients of digested food have been absorbed in the small intestine. So what is Purisha? It is the waste left back after the nutrients of digestive food have been absorbed in the small intestine. So Pitta and Kapha, they help in digestion and Vata controls the mobility during the process. Mobility during the process means it controls the movement of the digestion. So now, any imbalance between this can lead problems like abdominal pain, flatulence, constipation or diarrhea. It may also give rise to diseases as rheumatoid arthritis, osteoarthritis, low back pain, asthma, bronchitis, stomach ulcers and irritable bowels. So coming to Mutra, it means urine. Any imbalance of increased or decreased urine may cause problems like kidney stones, urinary infections, cystitis and bladder disorders. So if the flow of urine is not in the proper manner, then imbalances can occur in the increased or decreased state and it can cause problems like kidney stones, urinary infections, cysts and bladder disorders. So lastly, it comes the Sweda. It is a waste product formed during the synthesis of Meda Dhatu, that is fatty tissue. So while there is a synthesis in the fatty tissue, the waste product which occurs, it is called the sweat, that is Sweda. It is secreted by skin pores. So it controls the body temperature and regulates the electrolytic balance. The sweating is essential, otherwise it may lead to skin infections, itching and reduced body temperature. So in our body, sweating occurs and if it gets imbalanced, then there may be skin infections, itching and reduced body temperature. So in order to maintain the body temperature and regulate the electrolytic balance, sweating from the body is very much important. So now comes the Trayudesha Agni. It is a biological fire that controls metabolism. Agni balances all the changes in the body and mind like digestion and absorption of food, cellular transformations, assimilation of sensory perceptions and mental and emotional experiences. So Trayodasha Agni is nothing other than biological fire that controls metabolism. So Agni and Pitta, they are closely related to each other. The heat energy which helps in digestion and present in Pitta is Agni. So Pitta is the container and Agni is the content. So now Agni is acidic in nature and enhances digestion. It is related to the movement of Vata. So Agni, it helps in the movement of Vata. It is acidic in nature